We'll officially start for this exciting episode. So if you're listening, hang tight. The chat is live. You can ask questions during the episode, and we'll address them. And we should be getting going within under a minute here. Okay, go live button is ready. About 10 seconds or so, we should be getting ready to go. And we're set. Welcome back to Coach Connect. Here's where we explore the stories and strategies and insights from trailblazers who are transforming the world of coaching and well-being. What drives their success? What fuels their passion for helping others? We're here to uncover their secrets and share them with you. This show is brought to you by Vibely.io, the all-in-one coaching platform designed to empower coaches with tools, resources, and support they need to thrive and help their clients achieve meaningful, long-lasting growth. I'm Dr. Diego Salinas, your guide on this journey. As a neuroscientist, physician, and health coach, and co-founder of Vibely, I'm committed to celebrating the incredible work of coaches everywhere and helping them unlock their full potential. So together, let's dive in deep into what makes coaching a powerful force of change. Today's guest, Dr. Jessica Matthews, is a tenured professor and industry leader in the fields of lifestyle medicine and health and wellness coaching. An award-winning educator, she has created graduate degrees and professional certificate programs at several colleges in Southern California, including the Masters of Science in Integrative Wellness program at Point Loma Nazarene University, PLNU, for which she serves as the program director. Additionally, Dr. Matthews serves as Director of Health Coaching at UC San Diego Health. There, she has led the integration of health and wellness coaching services within both clinical practices and research, to include overseeing a team of national board-certified health and wellness coaches in the Centers for Integrative Health. A passionate advocate for whole person health, Dr. Matthews previously served as interim executive director and chair of the board of directors of the National Board of Health and Wellness Coaches, with volunteer service to the organization in several board leaderships spanning from 2019 to 2025. And additionally, she is a board certified in lifestyle medicine and serves on the board of directors for the American College of Lifestyle Medicine from 2020 to 2023. In 2021, Dr. Matthews was named Fellow of the ACLM for outstanding achievement in the field of lifestyle medicine and exceptional dedication to advancing the organization's mission. Presently, she serves on the Pritzker Scientific Advisory Board, providing subject matter expertise in the area of health behavior change. With extensive professional experiences and a propensity for driving innovation and change, Dr. Matthews is the co-creator of the Health and Wellbeing Coaching Conference, the first dedicated professional conference for health and wellness coaches. You can learn more about the conference at www.thehealthandwellbeingcoachingconference.com and on Instagram at Health Coaching Conference. Dr. Matthews, thank you for being on the podcast today. Welcome.
Thanks so much, Diego. It sounds like I've been busy for a while. When you read that wonderful bio warm introduction, it's like, wow, been staying quite busy out there. But what a joy to be with you today.
Yeah, busy, but always, anytime I met you, like positive, energetic, and you have a lot you give a lot. So something's definitely filling your cup. And so we read this, we kind of skimmed through the bio, but really curious to start off kind of exploring your why, kind of what drove you to be such a passionate person in the health and well-being space. How did you start your journey and what kind of thing led you here?
Oh, I love sharing this, and thank you for the opportunity just to set the why. Like that, as coaches, I mean, so much of this is so important for many more conversations I think we're going to have throughout this dialogue today. But my why, to be honest, started from the most challenging of times. And I've shared this story. Some have heard it before, some it will be new. But I grew up in a family where chronic diseases were commonplace. Type 2
Mm,
diabetes, heart disease, obesity, the things that, I kind of thought were just my family. It was my genetics. And to be fair, that genetics then was going to be my destiny. And what I saw,
mm,
Diego, at such a young age were the complications of those untreated chronic diseases. Things like renal failure, blindness, amputation, death at the age of 50. I mean, 55 of you were lucky, but the quality of life for the last 10
oh,
years leading up to that, they weren't there. And so it really sparked in me, how could I selfishly help my family, like the people I saw affected from a very young age? And also, how could I help myself and then in turn others to say, could there be another way? Could there be
mm,
prevention to these diseases? And then, excitingly, what brought me to lifestyle medicine later in my career was to say, and when you have these diseases already, can they be effectively treated and even reversed or put into remission? So that's really
mm.
the background for how I got into this entire health, fitness, wellness space over the span of my career.
Wow, yeah, that seeing the suffering of those around you and kind of saying there's got to be a better way. This current model isn't working, and supporting them, and both and saying let's look at treatment, but also prevention, and maybe both parts of the equation, not only one or the other, but the whole continuum of well-being.
Absolutely. And I'll share, Diego, just, kind of flashing forward to different parts of my journey.
Yeah.
That aspect of the prevention, I mean, so important. And also to say for people like my family, again, they became my case studies for many of the classes I teach or,
Mm,
articles I write where I just say they're real life human beings. And that part was so important to me. They weren't just a, person with type 2 diabetes, or to be fair, normally described as a type 2 diabetic. Well, that was my mother. So, I mean, the fact that I would hear also that description of like, it's just someone like checking a box of the description of who was a diverse, complex, beautiful human being. It felt like there was also more to understanding for people who these diseases developed. What can be done? That really, to me, that's a message of hope for people who, to be honest, many of my family members never received that memo of hope. It was just kind of like, this is what
mm.
it is, and here's what you can expect over the remaining years of life you have, which will be quite poor in quality.
Yeah, it's really going from this model of like treating a disease or solving a problem versus supporting a person. That this is just
Absolutely.
only one small or big aspect of a person, and to treat it as like, oh, everyone with this diagnosis, ICD-10, who has DM type 2, this is what we do. Done, right? Like it misses the whole point of it.
Absolutely. And that's where, I mean, so much of it, I know I'm preaching to the choir talking with you, and we've had, great conversations about this and with so many others who have gotten into the health and wellness coaching space to recognize, again, we have the privilege of working with whole people. And I emphasize the word whole because people are whole. They're not broken. They're not damaged. They're not, the often descriptions, they're not non-compliant or unmotivated. These are words, again, just since I spend time, as you mentioned in my bio, in a clinical context from a coach
Yeah.
perspective. People are whole, resourceful, and they are capable of change and capable of really taking ownership of their health and their well-being. And again, that's that message of hope to me.
Yeah, that hope and empowerment where um, it's I've seen it so often where someone, right, the diagnosis, even being the whole person, right? You can go, let's say you're on a certain floor. Maybe you're on the endocrinology floor. Why not? And everyone has diabetes coming in for there. Whatever the floor is, whatever the kind of common symptom is, you can go room to room, and on paper, there's the exact same diagnosis. When you walk in, it's a completely different experience. Some people are distraught, and this is like a, you know, they feel down in the nadir lowest part. Some people say this is I have support, I have family. So really, like just looking at a diagnosis on paper, literally flattens people out and doesn't allow them to have the hope and reach the community. What's their unique path forward? And you're right, medicine often just says, "Well, you have this. Here's your fate,"
Mhm.
right? Versus like, here are the skills you can use instead of pills to help you reverse this.
Absolutely. And the fact you mentioned, I think this is again where having a true, and I speak to, something that's so essential to the practice of lifestyle medicine, is it is an interdisciplinary team approach with really multiple members of care teams coming together to say there is a better way forward. And yes, I never want to, discount, because there's certainly a part of the equation when we talk about whole person health and just whole health in general, the things that also happen outside of ourselves, right? So have to name those complexities of the system. That could be a whole a whole separate episode in and of itself. And also many other factors, social determinants of health, like many things that sometimes, get synthesized like they're so simple.
Yeah.
And there's things that people can do within themselves. But very much like you opened this conversation, Diego, by asking me, tell me a little bit about your why. Like, how'd you get into all of this? Imagine if we did that with each of those individual, unique human beings you mentioned. So, yes,
Yeah.
diagnoses may be the same, but the people aren't the same. And understanding their why, understanding their support systems, understanding where they've been stuck. These are just
Mm.
a few of the things that we can get a better sense. And again, where I see real power in health and wellness coaching of helping people to get to where they do want to be. I've yet to meet, but I'm going to ask you, Diego, as a physician, I've yet to meet a patient, truthfully, who says, you know what, Jessica, I'd love my health to just be terrible.
Yeah.
I've yet to meet one. I mean, if you can tell me someone who just says,
Right.
now that doesn't mean people are at different readiness to change. And again, there's a myriad of different factors, but I've yet to have someone look me in the eye and say, I could just care less about my health. Not true.
Yeah.
people often feel stuck in saying, you know what, maybe I've wanted to change before, I've tried to change before, and you know what, it's just not happening for me. Maybe this isn't meant for me. Those were
Yeah.
some of my family members. And this is where I think, again, having a team based approach with different knowledge, skills, expertise, and the empowerment of patients, that's where we can make real meaningful change.
Yeah, you bring a great point. Like you mentioned earlier, this non-compliance kind of diagnosis, right? Which is a very, I think, problematic because, right, people can get into a state of learned helplessness. They're saying, right, where they just assume it's not going to change, but not because they don't wish it were possible. They just think it's not possible, and so and then outside the label as well, they're unmotivated. They're just they're not taking care of themselves, and no one explores. Wow, what the hard part is how to work on that hope you said, right? That drives. It's obvious to us as healthcare well-being coaches, but a fundamental part of changing is a belief that a change is possible.
Mm.
And it sounds like super obvious, right? But like if you don't believe change is possible, it's kind of impossible to change. And you're saying most people we don't address that that's the where they're at right now. Not because they wouldn't wish they could, because they're different. They just don't believe it's actually possible.
Absolutely. And that's where I say, again, there's so many factors come to my mind of also the biases. Remember, we all have biases, and an important part is also the awareness and checking and challenging of those
Yeah.
biases, but also those assumptions. And I say that get made when I hear non-compliant patient X or unmotivated patient Y. To be fair, often I've just throughout my career, Diego, I've turned the mirror back to myself and said, but what am I doing? And I think
Mm,
this, I mean, again, I say it's a really wonderful reflective opportunity for us as health professionals. So no matter what role you play, whether you're a health and wellness coach, a physician, a nurse, a PA, to look back at ourselves and say, is there something else also I can do? Now, again, people have to have that belief that they can change, they want to change, they will change, they're going to change, all of those kinds of change talk we often talk about. But also, there's an opportunity, and this is honestly in my career, starting in the exercise professions, because that was sort
mm.
of the first health behavior I really dove into in my undergrad and graduate studies and early on in my professional work. And what drew me to coaching, to be honest, Diego, if I'm being truthful, because I love to just be truthful and humble and
That's
say,
my next question. Actually, I love you went there. Please,
yeah,
yeah.
just to say truthfully, I mean, I'm a formally trained educator. I had interest early on in becoming first generation college student who said, I want to be a college professor. Talk about audacity. I
Wow.
didn't even know
Yeah.
what college entailed, but yet I saw myself teaching other professionals in the future. And along the way, as a classically trained educator, what I realized is knowledge is not enough. Here I was like, I've got all the latest science. I can break down things for you into really, bite-sized little informational pieces. But that wasn't actually changing the behavior of the real life human beings I was working with. So instead of just saying, you know what, they're non compliant, they're not motivated, they don't really care, I actually took a moment to say, is there something I'm missing? And I joke later into my doctoral studies in behavioral health, I said, oh, I never learned what happened from the neck up, so to speak, meaning all of that aspect around understanding the behaviors themselves and what are those key ingredients to health behavior change, whether it's
Yeah.
exercise, nutrition, no matter what it is.
Yeah, and I think that's where I've had a similar kind of aha in my own sense. But I think because the approach right in studying is that if you learn something, knowledge is power. You can do whatever you want, right? And in school, we're reinforced for getting good grades, for getting good, know what to do, and solving the problem. And then there's definitely obvious cases where information is required to make a change, right? Knowing that sweet potatoes have starch in them, so don't eat a bunch of sweet potatoes as your vegetable. Right. Sometimes there is that point. But to your point, I think we try to wish the brain worked a certain way versus how it actually works. We wish that if we could just give it more information, it would do the right thing. And I think if we just step back, okay, we're not sure exactly how all the parts of the brain work, but clearly just more information alone hits a certain limit. That's very not sufficient. Right. And something you said earlier on about mentioning the complications of type 2 diabetes, eyesight loss, kidneys, limbs. I remember being in residency and seeing people with type 1 diabetes. So, people's autoimmune condition, they have it early on, 5 to 6 years old. So, because they have it early on and they don't have any insulin they produce, they have a higher, complication rate later on in life. They have more time under the curve, so to speak. And one of these kids, adolescent, came in with complications from not treating it well, from not handling his blood sugar well. And I remember the talk was like about all the symptoms. Well, you're gonna lose your eyesight, you're gonna lose your kidneys, you're gonna right. But to your point, no one asked them, why do you want to see? And if we keep on just giving more information, I think we can. If we step back, I said at a conference, I'll give a different example here. No one's ever gone through a drive-through and been like, "What? I had no idea Big Mac with extra fries and a Coke wasn't healthy for me. I didn't know that." Right? I still gone through drive-throughs knowing that. Right? And to the point that like we're focusing on the wrong area and wishing, kind of ham-fisting, if we just get more information, it'll finally do the right thing. Instead, I think coaching says, how does the brain actually work? Let's follow this strategy. And that's where the evidence shows the most change happens.
Absolutely. I mean, so many things you just shared, Diego, that I was just like, yes, yes, and yes. I mean, the fact that one, fear is not enough of a motivator. So, you and I
Mm,
could sit here, or maybe some, individuals listening to it say, gosh, if someone told me I would lose my eyesight, I would lose a limb. I mean, I might not live beyond the age of 50 or 55. That would be motivation enough. But it actually isn't strong enough of a motivator. Again, not
yeah,
my personal opinion, but you can look to the literature to say for some people it is, and for some people it's not. Like,
yeah,
remember, we just talked about people are unique. People,
right,
different things will be kind of those drivers. What an interesting way to think about why do you want to see? I mean, gosh, I could think a long laundry list of things would come to my mind of like, wow, why I want to be able to see, why I want to be able to be able bodied to do the things that I love doing. But those often aren't the conversations that
yeah,
happen. And information, yes, I do appreciate because I will share sometimes in the health and wellness coaching space. I do almost hear it's like an either or. It's like information, nobody needs that. Well, that's not entirely true. We do. I mean, people do need to bridge
right,
knowledge gaps to have better understanding. And knowledge alone, as you said, it's not enough. It's not sufficient. And again, the science supports that to say, I mean, if it was true, if you ask most people, you said it perfect. Should you exercise? Are there benefits to exercise and eating nutritious, whole plant foods? People will be like, uh-huh. And do people do it in practice? Not so much. I mean, based on the data. So there is
yeah,
that disconnect, but knowledge is a part of the equation, but it's not the entire ingredient base for this recipe of behavior change, if you will.
right. Term we say in research, right? Necessary but not sufficient. And so the example I sometimes give, and I've given it before, is smoking cessation, right? Whenever the year was, the Surgeon General said, "Hey, we found out smoking is a very strong risk of cancer." Yeah, you saw people do it less, but just do it less, right? That was what in the I don't know 40s, 50s, 60s. I don't know what year it was off the top of my head, but decades later, it's still an issue, right? So just kind of example that the study show the evidence shows not enough, and the example you gave also of that bad news could be this awakening. Oh, well, I almost had a heart attack, and I'm gonna get my life together. Kind of the movies are, right? You have a low point in your life, enough is enough, and all of a sudden you do this stuff. The reality is that for some people that could be the case. For some, it can be the exact opposite. Those bad news can be freeze or an activation. And maybe I'll share a story I heard when I was in medical school from an oncologist that taught us. So, oncologist being a cancer doctor, he was sharing a story of a lady came to the clinic where her breast cancer had been so advanced, right? Had all these signs and symptoms early on, so advanced that she came in after the night before her breast tissue had fallen off. It was so dead. And then he said this story kind of really solemnly, and I still remember the lecture. He said she was a doctor. So the point is, why don't we just look at what actually happens versus how we think the brain happens? And that's what really hits me hard. But I'll say, just kind of moving maybe the needle forward a little bit. You've gone through this career of you mentioned focusing first on movement and personal training, realizing behavior change is where it's at, right? And then getting a health coach yourself, and then fulfilling the dream, teaching a program, being tenured, training others, working in leadership. Tell me kind of what drove you to say, all right, I go a little beyond myself and what I can do here, but really create systems of change. What drove you there? Kind of maybe some interesting things on the way from that journey.
Yeah, it's interesting when I reflect back, I go a whole lot of audacity, Diego. Is that the answer to this? Maybe, I mean, just like who was I? And I only give that frame of like myself as a first generation college student. Like, what a bold like vision to be like, I one day will be a college professor, having
Mm,
no background, experience, family to lean on. to say like that could be possible for me. But yet I thought that was possible. And talking about people in my life, I did have people in my life who said, and we might not know what that journey looks like, but we believe in you and this vision that you have. And along the way, I think what I saw is there was things absolutely that I could individually do. And I loved always, and I've always had, interestingly, a lot of people don't realize this about me while I wear a lot of hats, so to speak, professionally. I've always had boots on the ground presence, meaning I
Mm,
have always throughout my career worked directly with human beings, like
mm,
in whatever capacity. If it's teaching group fitness classes, teaching yoga classes, coaching individuals one on one, I've always maintained that because I feel like one, that's such a privilege, but two, there's so much learning that happens. And that I think is so important. If you want to see real systems change, I think it's really important to have that perspective and not talk about things lovingly in theory, like to actually be immersed in it and to be really humble in it. So I'll only share with you kind of along the career trajectory. I saw this real opportunity for the integration of health and wellness coaches within clinical practice. And again, it took me
mm,
back to my days in the exercise professions where that was a bridge. It was always the bridging the gap that needs to happen. And if I'm honest, Diego, it still wasn't happening. And so it
yeah.
kind of just prompted me to say, well, what is the disconnect? And to honestly be able to understand that better, you know what I couldn't do? I couldn't just in theory from the outside be like, healthcare is broken and this is the problem and here's what they need. I didn't know anything about what was on the other side of that fence besides being a patient myself. So again, I was
Yeah.
trained as an educator with my doctoral studies. You know what I did, Diego? Humbly said, I'm going to go learn everything I can about healthcare. Like as the brand new, I mean, I'm already deep into my professional career and here I was so humbly going, I don't know what I don't know. But you know what I'm
Mm,
here to do? Learn about it. Because instead of telling the healthcare system, and now I'm, at a large academic health center, as you mentioned, instead of telling them, hey, here's what you need, because me on the outside thinks this is what, I mean, it sounds funny saying it, Diego, but I hear it all the time in the
mm-hmm.
field. Like, here's what
Yeah.
we need to do. But we should actually understand both sides of the fence, so to speak. So that's what I immersed myself in over the last 8 years. Said, let me understand where are those pain points in healthcare? Where are the champions? Because I also hear this
Mm.
broad brushstroke statement of, all physicians don't care, they don't take time. I mean, that I'm saying this to a physician who I know
No,
like
but yeah.
embodies the coach spirit before you even became a coach, right? Like that's so not true. And actually
Yeah.
finding real collaborators, real champions, coming together around a shared mission. No one person will create real systems change, but together, oh, we can do amazing things. So those are
Mm.
just some highlights of what I saw. And then the audacity to say, I think I could be a bridge builder. And I've been loving doing that ever since, my early days in the professional field.
That's beautiful. I wrote down a few reflection points here, see if I can summarize some of this inspiration you've kind of given me. That I think one thing we share in common is that boots on the ground experience. That I love zooming in and out. So if I am working a coach, running a coaching company, I'm still coaching clients, right? If I am teaching this, I'm still doing it. That the people want to solve problems from the outside, and frankly, I think healthcare, part of the reason why it's so broken is because of that exact same mentality. A bunch of people without any healthcare training running healthcare. And this is where I get maybe a little chip on my shoulder here, but I got frankly sick and tired of someone saying, you're spending too much time with your patients and say, hey, where's the liver? Like, I don't know what that is. Like, I don't know how to fly a plane, to your point. Like, I can be a passenger, doesn't mean I know how to fly a plane. Being a patient doesn't mean you understand healthcare. And having an MBA doesn't mean you can solve all businesses. And there's this hubris that people have, like, well, I have this and this and this, and I know numbers. You're like, if you don't understand the humanity, what's happening, or the code, or what the treatment means, how can you do that? And now, well-being or healthcare needs people beyond just those healthcare workers. It's that you mentioned teamwork with the dream work, that working together is going to make it happen. But it should be those people who are giving the service, providing the care, whatever industry it is, who they hold the learning of what needs to happen. And if you're, why would you be the general in the army if you've never shot a gun? How can you run a hospital if you've never, you know, don't know what a cell count is, right? And I think we see that too much in healthcare. And I'm excited for our collaboration. Something you mentioned about working together, a little long-winded, but when I was leaving residency, I was saying to my advisor, like, how can I help out? I can't do it all. What can I do given my passions about this? I remember she said, Diego, I know you're carrying kind, but it's a David and Goliath thing. It's too big of a system. I recommend just find a full time job and see what happens. And I left her office and that hit me kind of in the hallway. I'm like, wait a second, David wins that fight, actually. To work on your analogies. But if even if you didn't, rather die trying throwing rocks. And healthcare people see the suffering on both sides, don't realize who's causing it. And so my whole thing is let's see who wants to throw rocks with me. So Dr. Jess, glad to find someone who's a fellow rock thrower and be like, let's collect those slingshots and go for it.
And I love. I mean, first of all, I love that you're just also like, oh, and it's good to know how the whole story played out. By the way, in that analogy, but only to say it is that is how great things are accomplished. And even when I think about, yes, the work that I've been able to do, but I say it's really the work I've been able to be a part of. Like
Mm,
nothing happens in isolation. Again, there'll be prominent voices, or sometimes there'll be more airtime given to some. But the truth behind the curtain is, it's always multiple people coming together around a shared mission and a vision and making that actually happen, because there are different insights and expertise and things that are needed to create real systems
mm.
change. So the idea that one person has that entire answer, I mean, again, I immerse myself in healthcare, and then to be like, I'm the resident healthcare expert, I would never claim to say that because it's so complex. But now what I say is enough to be dangerous, Diego. I learned enough about the other side of that fence, so to speak, so that I could actually help create the bridge and say, have we thought about this approach? When we talk about, I don't think probably anyone listening to this right now is saying, that health coaches shouldn't be in healthcare. I mean, that's like such a no-brainer. And there's a lot of inner workings to understand. So it often feels like there's like heads being banged against a wall on both sides of the house, so to speak, of like, well, we
Yeah.
want health coaches in healthcare. Do you want to be honest? What healthcare administrators are saying is, how in the world do we pay for it? I mean, dollars and cents. I mean, that is how the world
Yep.
goes around. Not my
Right.
choice, but I live in the real world. Conversely, coaches are often saying, why don't they see the value in us coming into healthcare? And it's like, we're actually not saying the right things to each other, nor understanding the inner workings of both sides of that house. And so that's
Yeah.
where I just, again, have leaned into the opportunity, whether it's in clinic, whether it's in academia, because I also realized in my own journey, Diego, why didn't I learn this stuff so early on in my academic training? And that led me to the creation you mentioned of the program at Point Loma Nazarene University, where it was just like, we need to reimagine things. And in an
Yeah.
interdisciplinary program, got to bring the right perspectives, insights, experiences, and expertise together to make that happen. But I love being the conductor of the train, if that will help bring the right parties into the right place to make meaningful change.
Yeah, yeah. It's mentioned so it's getting so complicated, but it's still so siloed out. And I think health was a really unique opportunity to be that glue, that cohesive glue. And the example you gave of the two sides of the coin here, right? That people say, why isn't it covered? How are we going to pay for it? It gets into understanding systems, right? The fact that most insurance in the United States is by your employer. People don't stay at jobs very long nowadays. So there's not much incentive for your employer to pay for your prevention because they're not going to get the benefit of it. If they were forced to, cover your healthcare for the next 30 years, they would definitely put money in prevention, but they're not forced to, right? And so you're right, it's kind of challenging let's look at what actually is happening and then accepting that as a starting point. Acceptance doesn't mean you condone, you renounce it, but we have to be really clear the starting point and work together in kind of creative ways to work around or change that system. And maybe this is a nice transition to um, the conference you started, right? Because community is medicine, it is well-being, and a shared value definitely the conference invitably has is that I hear awesome idea from coaches all the time, but they're in silo by themselves, and I'm like, let's put them together and see what happens. So curious what you uh, big profession in academia, work with the boards, all as the American Lifestyle Medicine, already a leader in the field. What was the impetus between you and Jay kind of saying, should we be a conference? I'm hear like a little bit the origin of the conference story and how that started.
Yeah, I love telling this story about. So, Jay, for context, Jay is my wonderful husband. He is the co founder of the Health and Wellbeing Coaching Conference. And that might strike people a little odd at first, like your husband, he's not in the health and wellness coaching space. But really, this started honestly in 2018, just as again, the field was really starting to professionalize. So,
Hmm.
we've only had, I mean, just for context, and I say it's exciting when I say this, it really shows the real movement, but we've only had a national board certification since late 2017. I was part of the first cohort of coaches to earn the board credential. But I only give that frame to say, wow, have we covered a lot of ground? And that's, again, a testament to, as I mentioned, a lot of people making that happen. Not one or two or five people did that. A
Right.
ton of people have made a professional field. And in developing and continuing to evolve a professional field with credentialing standards, with training and education standards, what really I saw was missing was, as you noted, how do we harness the collective wisdom? How do we get
Mm,
people together? Because we don't have a professional association in the field of health and wellness coaching. And just spending a lot of time, myself as an attendee and a speaker at conferences, I recognize that a conference, an in-person conference, so again, this was pre-pandemic, an
mm,
in-person conference, that was an opportunity to bring people together, to share ideas, to learn what's working, what are the pain points we face as individuals, so we could start breaking down those silos and say, if we want to see a field move forward and impact the countless people that we could positively impact, how do we come together? You've got to bring people together before you start seeing a lot of segmentation, which often happens when you see, many training programs and many different, it starts further creating more silos, interestingly. So the
mm.
conference started as an opportunity to bring people together. And it got postponed a couple times because of that pandemic. As you know, 2020 was not a good year for an in-person conference we had planned. And then I had quite a health challenge in 2022. I almost died, Diego, which was pretty terrible. And only to say in 2023, we launched it. And we
Wow.
really believe in what this community, the power that this community has to shape the field going forward.
Don't call it a comeback, right? From death's door to launching a conference.
It was kind of crazy to be like, yeah, I was like in the ICU. I mean, like literally like 48 hours to live. Kind of like that's a story for another day for people who want to hear that. I'm always happy to tell it.
Yeah.
But like 2022 in June, like in the ICU, like for the better part of that month, just like not going to make it to then literally the next June. So talk about a comeback. That was the health and well-being coaching conference, and people showed up and people were passionate, and it was just this community just formed. And again, that's
Mm,
like my spirit of being a bridge builder. And I have to say it because I say it boastfully but excitingly. Jay and I invested all of our own money in it. Like we
mm,
self-funded this entire conference because we wanted it to be an objective. Like there was no stake. This is not me as a program director or any other vested interest. I'm just a human being, a fellow coach who saw an opportunity to be that bridge builder and bring people together. So it was a lot to bet on ourselves, but wow, has it been really impactful.
yeah, and I was able to go. So little side story. I went last year. I got serendipity. Oh, I don't know the right word to use here, but when I found out about it, it was already full. So I was like, all right, I'll do the virtual version. And then I was like, let me just send a quick message, and I was like, hey, this conference is amazing. I found out a little bit late. It's already sold out. If there's anything I could do to, go in person, I'm basically saying I don't need a seat. I'm happy to stand, you know. And then it was like, hey, someone this morning had just unfortunately had to cancel. Can we do so? Like that day, bought my ticket over to San Diego from Miami, and then I think however many days later, a week or two later, I was at the conference. And like you have been to many conferences, and what stuff me was just so different than any other conference I've been to, and the values of it, kind of you said, it was not a bunch of ads. It was like the speaker's quality was, and the community sense. It was so homey, if a good word, in the best sense of the word, while still being professional, right? That's the first time that you and I had a chance to meet in person, but it really, when I went there, I was like, I'm for sure coming back next year. Like this was amazing, and the well, let me pause there. I'm gonna give you a chance to say a little about it. Like maybe you could just talk to how your conference is so different, like the some of the ways that you set up the values for your conference and how they show up. How about that? And then maybe I'll give some examples that I thought of.
Yeah, I love it. And it's so impactful. And I remember vividly that like it did just like it's just came together and for you to be a part of it and experience it because that to us kind of one of the differentiators is it is an experience. Like it
Yeah.
is it's how fitting, a full circle moment in our conversation that it's not just about the education. Of course, and I only say of course, but I say this as a tenured professor. Of course, the education at a professional conference, in my humble opinion, should be stellar. I mean, for context, as you know, last year we had Bill Miller, like the Bill Miller, founded motivational interviewing.
Yeah.
Like that's the caliber of speakers we've had, and people who really can again give that real expertise, that boots on the ground wisdom, voices that often I share the other part that I've just seen again being in the conference world in a lot of different across different fields, health professions. I've spoken at a lot of events myself, and honestly I'd say what did I find didn't work about them? The fact
Mm,
that there was a ton of pay to play, meaning if someone had the most money, you got stage time. And then, respectfully, you're hawking whatever goods and ware you have on the stage. And I just felt like that detracted from one, the caliber and quality of education, and having some objectivity to the information. And that was again why, like my husband and I, we're just a husband and wife team who puts on this conference. We don't have something else we're selling it. We have nothing to sell anyone. My husband works full time for the fire department, Diego. So
okay.
we're not in the business of selling anyone anything. We want to be a space where people get to come as they are, like a conference for the people, by the people, with the people. Like that's what a
Mm,
conference to me should be, because to us, the conference is just really a catalyst for transformation and movement of the field. And we
mhm.
just love that we can create the space, that homey environment, and we can practice what we preach, Diego. I think it's crazy that a health and wellness coaching, health and wellness event in any type of health capacity doesn't provide nutritious meals. We do that, all catered meals. I mean, it's like hosting a wedding 3 times over now for us, but we're going to feed people nutritious food. We're going to
Yeah.
create activities where people move their bodies meaningfully, where people have time and space to fill up their cup because we pour so much into the people we serve. But what
Hmm.
about us? Like, how do we keep serving if that's not sustainable and nourishing for us? So these were just some of the things we said. If we're going to do a conference, to be honest, we're going to do it right. We're going to have a little fun, Diego. Like, we're going to put on fun music and we're going to move
Yeah.
our body. And, like, we can do that and be professional and be top tier. And I would say I will welcome any feedback. But the feedback we've gotten is we're achieving all of our objectives plus many more things we didn't even anticipate in the process.
Yeah, I can be a testament to that. So I mean, the experience you said that there's such a let's say may nerd out about neuro and community here, right? We are so wired for human connection to motivate, inspire, and give us energy, or give us affect us even beyond the experience, right? So there's all talk about AI and coaching, computers, and people. Bottom line is this: I say, go on a date with someone, you feel differently for a few days afterwards, right? Doesn't happen when you open ChatGPT or not. We have this power as human beings to inspire in the moment and create ripples for us in the future. And so part of it is I was gonna because of this, educational component. I was like, let me go to live event or online if I can't come to live. But I've also known what experience when you're in the room with someone physically. Like right now, this is amazing, but actually being able to see you, give you a hug, say hello, like see you in passing. And there's this collective when the whole room, when this whole community is on a similar wavelength, right? Of a value, a vision, of a hey, we can actually do this. We're not in our own silos in our houses, or apartments, or communities. There's people out there who see the big vision if we work together. There's so much inspiration, motivation, right? The catalyst mentioned for change. And so if you can go in person, I mean, virtual is great backup, but if you can go in person, nothing replaces human connection. And those times between the speakers, like you said, with the amazing meals, healthy foods, and I did, if I can also say, I really appreciated the focus on education as myself, a huge nerd, love learning, love talking, love speaking. It wasn't a bunch of people showing something to 5 slides to then do 15 slides about why their product solves the issue. And to the point where I got so familiar, got so such a good experience with yours. I went to other conferences later on. I was like, why am I not motivated here? Why am I not getting stimulated? Why is no one giving me a challenging thought to think about? And you mentioned Bill Miller. I had lunch with Bill Miller and Dan Orlovsky like that day. I was like, this is crazy. Like, this is amazing. So you really did create community. And I'm happy to share one of my stories kind of came afterwards, but curious any stories that you've heard of people like, from the conference, kind of collaborating, working together afterwards. Any stories people shared with you?
Yeah, I've heard a lot, and that's that's the part we love, and our community provides so much feedback. And again, I say the feedback is also, ways every year we're like, what can we be doing more of? Like this year, we're adding breakfast to, like, we're having breakfast, lunch, where every meal we can have together, we're having meals together. People want to have more time with each other, so they want quality education. But they said also we're in such a beautiful environment. I mean, we are in sunny San Diego, California, right along a waterway. Like
Yeah.
it's like
Yeah.
pretty picturesque. Again, sort of sets the tone, which I think is also important. But also, people said we just want time to be able to connect. Like, we want to have that shared meal together. We want to go in breakout rooms in the virtual. So I will share, as someone who does teach a fully online program, my intentionally long before COVID, to reach people and break down barriers of geographic location. People who can't, the cost to come to San Diego, to be in person, hotel, flights, all those things. We created that virtual live stream option. To be honest, it came from our community. Somebody asked, could you live stream? And we're like, I think we can. We're going to find out if we can. I mean, if I'm being truthful, we said we'll look into it. And that's year one. We did that. We launched it and we said, if people are joining from all around the world, they're going to be just as connected. It's different, of course, as you mentioned, in person and sharing a meal, but we could cultivate that community intentionally at a distance.
Yeah.
And it takes real intentionality to do that. Just setting up a camera and being like, that's not enough to create the community. The things we've
Yeah.
heard, to answer your question, one of the first piece of the feedback we got year one was from one of our live stream attendees who said, I've never felt more connected. It wasn't just
Mm,
like I was observing something from the outside, like I was in it. Even if I couldn't
yeah.
be in the physical room, I was a part of this community. What's happened? People have formed groups. I know you could share a little bit about the group that I know you've been actively a part of. They formed groups that have stayed connected and they've grown beyond the conference. Like, this is exactly what we had hoped for. People who've come together to talk about businesses, maybe starting new businesses or elevating existing businesses by merging together, power in numbers. And
Mm-hmm.
also, people have said, even could we come together and maybe even have a professional association in the future for the field? I mean, this is the kind of connection that happens at our conference. And we couldn't be more excited that this is the output. It's not just come to an event and then it's a blip in time, it was fun and it all ends. It's that catalyst, as we were talking
Yeah.
about. That's what we hope the conference can continue to be.
Yeah. And before I share the group story, well, I'll share my story first and I'll change the gears. But kind of during one of these breaks, right, I was talking to some people there, and I'm bilingual. My parents are from South America, and some of these coaches were also bilingual. And we started talking about how different it is to coach bilingual population or Spanish population, not because of the language, because of the cultural considerations and perceived power dynamic differences, and how even being bilingual is the huge heterogeneous population. Right? Are you first generation? You only speak one language? Central America, South America, a bunch of different cultures. And in this kind of discussion, someone goes, let's just start a little like, hold on a second, we should like continue. There's something here. We've been wanting to connect with other people this way. And I think it was Katia just pulled her, or Angelina, I forget who, just pulled her phone out and started WhatsApp. They're like, oh, we use WhatsApp, right? So create a little group, and then that formed to the whole conference talking about it. But then we said, let's meet on Zoom, and now we have this bilingual coaching support group. Which, by the way, if anyone's bilingual coach, send me a message at Diego@Bawi.io or on LinkedIn, and I'll happily add you. We have a WhatsApp group that we share what's going on with each other, share resources. Google Drive, we created a little Excel sheet, and every 2 months we do a meeting and we take turns. Someone presents on a topic, and then we introduce new members. Like that happened since almost a year ago now. And what a great example of just creating the space for in community and letting people let that motivation really go from idea to action.
Can I share that to you? I'm smiling ear to ear because I have to full credit. Angelina really was the one. She approached us kind of like same way you were like, let me reach out and see what might be possible. Angelina had reached out and said, hey, at the conference, like, I'd love to hold space and just, have conversations with other bilingual coaches and just like see what emerges. And I was like, first of all, and Angelina, I hadn't met her yet in person. I was like, these are our people. Like, these are our
Yeah.
people. This is what we had hoped for to create that space. And I'm excited. There will be a meetup at the conference again this year. And Angelina is going to just help facilitate that so that the
Yeah.
groups can continue to form and grow. And just, again, we can support and empower each other. because that was the thing I had seen in the field in the many different, seats that I was sitting in, from national, board leadership to academia to clinic. It's just there were so many people feeling like they're so impassioned about coaching and what it can really, the value it provides, and how they can really help to support and empower people. And if I'm being really truthful, feeling really frustrated. Like, how do I, get into these spaces like healthcare or workplace wellness, or, what might it be like, to think about different populations I'm really called to reach, and what might I need to know, and what knowledge gaps, to be truthful, kind of again, full circle, what I have. I mean, it's a reason why
Hmm.
we have, I think about the program this year, got David and Keisha Bowman talking about, addressing equity and cultural curiosity, both in lifestyle medicine and health and wellness coaching. I mean, the kinds of things that are not only the competencies for, the credential and the board exam, those are important things as well. And also the real, again, thinking of whole person health, and whole health meaning beyond just the individuals, the systems, and how we can really impact change. That's really, I'd say, the theme, if you will, for every
Mm.
year of the conference, but especially this year, because we are at a critical crossroads for the field, is what I see. Again, I speak from real boots on the ground experience, sitting in a lot of different seats in this industry.
Yeah, and the talk about different topics. I think it is also what really leads to a sense of community there, because it wasn't just. You're right. Some conferences are really nice. You learn a little bit and maybe it's a nice setting, but by like Wednesday, by Thursday, the conference feeling is gone. Right? Nothing's good or bad. Just kind of it is. You're back home, and there's a sense of like, here are our people, right? And I can finally and the range of topics, like you mentioned, not just covered both on in the tables but on stage. What does it mean to be a health and well-being coach? Sure, there's some information about competencies and group coaching or nutrition talks, right? But also about equity and diversity and what it means to cultural considerations, taking care of ourselves, coaching and beyond. It was this really 360 look at all these different nuances, aspects, and future vision, and that was so well mirrored on the stage and in the conversation. It wasn't just a technical conference or only a support conference. It really was all encompassing to these nuances that only we kind of really understand.
Well, and that I appreciate you really mentioning that part, Diego, because of course, while we do take great pride and great care in intentionally curating the sessions, the speakers, really putting together that thoughtful programming, the other part that does make our conference unique, I think it is very different than honestly any other conference I've been to, is we leverage the collective wisdom in the room. Meaning, it doesn't mean somebody on the stage is the only person with the knowledge. And that's the part that I think is when I say, for the people, by the people, with the people. We learn
Mm.
so much from each other. I mean, the people who come together for the conference, they're sharing with each other. They're sharing with the speakers who are like sitting, as you mentioned, they're sitting at the tables eating lunch. Like, there's not this like distinct, like there's this elite group or these figureheads that the field is only these several people. I think that's
Yeah.
crazy. I mean, there is so much wisdom and expertise and real experience. And I say the boots on the ground, don't miss out on that experience and insight from the people who day to day work with real life human beings. It's why
Yeah.
we do think about that composition of who are our speakers from every lens of diversity you can think of, but
Mhm.
also how do we create an environment? And that's why we are intentionally space limited in person. Like, we won't be a mega conference. Like, that's not our vision. I mean, someone business wise says maybe that sounds silly. It's not silly to us. We know
Yeah.
what the vision and the mission is for our conference. We want to be accessible, which is why we do have the virtual live stream option, but not lose that community, not lose the intentionality, and not lose the quality. Because I do think, as you mentioned, when you start getting into like there's ads on the stage, I mean, it gets a little tricky to maintain what I think is the integrity of an event.
Yeah, tricky is a good word. Just as a client, as a member of the conference, you just like it breaks a fourth wall. It's like the sheen's got like you kind of you have to pretend not see it almost, right? And the value conflict that show up. But to your point, the speaker list, right? Like last year, like yeah, lunch with Bill Miller, Don Orlowski, um, Ruth Wolliver was there next to me. Karen Lawson, Linda Smith, and it wasn't a there's no hierarchy feeling like, oh, these are the speakers, this is everyone else, or there's a special bat. It was everyone is there as a coach to a coach. What can we learn from one another? There was no, it was so inviting that way, and whether that trickles down from you or just coaches, we are that kind of that headspace, but it was or heart space maybe even. everyone's the same. We're here to learn from each other. And it was really this wonderful sense of community. And I was going to say this earlier. I remember when I first went there, admittedly, I'm not knowing much, but we've been to so many conferences, we think it's all going to be the same. So I remember seeing there day one, and you're talking about how this conference is different. And, for example, there wasn't any kind of pay to play. It was people, be chosen, or um, if people were to give, is to donate to the community or something else, right? And that to me, if you can talk about the speaker list, or how you guys come up with this idea, because it is so different than every other conference I've been to, applied to, and I was like, that's what's amazing about this. So if you mind speaking a little bit to that behind the scenes approach, or how you're so different there.
Oh, I love that you highlighted what has been really important to us from day one, which was, people would say, traditional conferences. So I just say that because it's very, conference world, if anyone spent time in event planning spaces, there are a lot of just general nuts and bolts to how most events work. And if I'm
Yeah.
being really truthful, again, because I can be, since we pay for the conference, conferences are not cheap. Conferences with food every meal throughout 3 days is definitely not cheap. It's
And
why
quality food.
and quality food. I mean, so not only food one, which is like almost unheard of, and then to be quality, nutritious food. Because again, we should practice what we preach. It's one of our. We have a few standard phrases that have just come out of the conference.
Yeah.
We believe that we should be modeling that. I think it's very remiss to be like not feeding people or feeding them non-nutritious food and be like, we are health and wellness focused professionals. That's crazy to me.
Yeah.
But people early on, we did get a lot of interest in sponsors. Like sponsors would reach out and say, how can we sponsor the event? And one of the first things we said is, you can give back to the event. Like you can help get people here. You can help with scholarships so that people can be supported in their journey. You can help by equipping them with tools and resources that, they can stand up or scale their coaching business. Like those are the kinds of things that we felt like if we could equip our community with the things that they needed, that was the best kind of approach versus just saying sort of what's in it for us as a conference. Now, again, because business should be talked about, Diego, in the coaching world. And it's
Yeah.
actually, I'm going to tease, we're going to make a very special announcement of we're known for surprise and delight. You might have remembered that as one of our
Yeah.
infamous phrases. But that just became of like, we wow people. Like, we know the investment people are making in coming to a conference, whether virtually or in person. And we said, we're not only going to deliver the value you expect, we're going to far exceed it. Why? Because why wouldn't we? I mean, we should be
Mm.
investing in the people who invest in other people so wholeheartedly. So, talking about the business side of it, does need to be something sustainable because we want it to be a community that can keep growing and keep flourishing. But when it comes to the speakers you asked, really being intentional about, if I'm being honest, where are the gaps in our field? So, again, sort of
Mm.
like, we know what we know. And if I'm being truthful, I hear sometimes a lot of the same things repeated. It's like we're stuck in a little bit of an echo chamber. It's
Okay.
not
Yeah.
unique to health and wellness code. It's like every professional field. So I just want to demystify every professional field does this. This is what happens when you hear the same people saying the same things over and over. It doesn't make them like they're not impactful or they've done great things, but you just get stuck in sort of this continuous loop. And so
Yeah.
part
Yeah.
of the speaker list, to be honest, we wanted to ensure that it's not a few voices or the dominant voices, that there were speakers who maybe you haven't heard from before. They're not speaking at 8 other conferences. They're speaking maybe for the first time at our event. They're also
Mm.
the people who are the pioneers. I mean, so talk about like a whole continuum. There are people who are talking about topics that maybe haven't been addressed. And I do want to share, Diego, if I may, a little, like, 'cause it's
Please.
public knowledge now, but like you're speaking about the neuroscience of behavior change. This is such vital information that, to be honest, hasn't historically. It's a new competency now for 2026 for health and wellness coach training programs, but hasn't been something that has been consistently discussed in our field. So we looked at where's the gaps, where's the opportunity for new voices and perspectives. And so a lot of time and care, you can imagine, goes into putting that program together, but it's been very rewarding. Absolutely.
Yeah. I gotta say, as attendee, I'm super excited for the delightful what we're gonna learn there. So it really is tripping out. Yeah, we here to delight, right? And there was all these surprises there. So you definitely got me curious. To be honest, even what's already out there is enough. And I want to say do feel honored to be a speaker at this year's conference. So the neuroscience being on the programs is because of the work that you helped start with the committee for the update committee. So just a little quick context for everyone. There's a criteria for standardization for programs and for exams. That's what she was talking about. 2017, the national board exam came from off of this gold standard of what to be covered. And that hadn't been addressed since 2017. It was a little overdue. And so when she was interim director of the board, it was like, we should update this. And we thought it was going to be a few day, kind of long week project. It may be a whole year long project over time. But really looking at what do programs need to do moving forward and what do coaches need to be tested on. And I was honored to be part of that committee with 14 other amazing people. And we all contributed so much. For me, I was like, I really fundamentally believe neuroscience or neuroplasticity needs to be on there because you're right, a lot of changes happening up here, not just down here. So it's for me, my own full circle moment. When people tell me don't try change, David Goliath thing, to actually pulling up to the MBME to work on this, and I was like, for the National Board of Medical Examiners, and I was like, this is where I took my step exams like 12 years ago. Here I'm helping add it to a new field, like my past knowledge of neuroscience there. And so it's a topic that I'm passionate about. I'm a nerd. But to your point, I hear from a lot of people, well, what's going on there? And I think there's a lot of imposterization with coaches not knowing the science behind it, not fully or wanting to know more, maybe. And if we
Absolutely.
know more, we are more confident providers, but we can be fully transparent with our clients. Because what I say about a little neuroscience side here is that coaching is science, it's not advice. When you learn how science works, it doesn't stop working. When you learn how insulin works, it doesn't stop lowering your blood sugar. When you learn how oxygen works, you don't start suffocating. We can be fully transparent with our clients of what we're doing. I tell all my clients what reflection is. It's still very effective. When my coach coaches me, I know what they're doing. It's still very effective. And maybe even more effective because you realize the art is based in this foundational science. There is art to coaching, as most things that we're applying that are abstract and complicated. There is, of course, an art initial component, but all the paintbrushes are based in science, what we're painting with. And so to me, that's exciting for the field, which I think will also help providers, but even clients understand, build trust. There's a science here, but I'm part of that. I'm one of those colors, a very important part. I'm the one who finally is going to make the drawing here. So I'm super excited to be there, especially knowing the values that it's how can we serve. And I've already been thinking about fun ideas to make it really interactive because you've been very generous to give a 90-minute slot to nerd out about neuroscience coaching. We're doing very experiential experience. So really honored to be part of that with amazing other speakers you have, Dr. Jess.
Well, I love that I mean, just the energy that you bring and the shared values. I think that part really big, like a moment to just highlight that because that is what makes the conference special. It's, yes, of course, we do a lot of planning and intentionality, but it's the people who come together and really believe in what's possible for our field, believe in the next evolution. And I do appreciate you giving that background and context. And I only want to share just from having come from the exercise professions. And I spent time in the credentialing world in that space, with medical exercise specialists, personal trainers, group fitness instructors. I use another parallel non-licensed health profession. So when I served on the board, served for almost 7 years for NBHWC in different capacities, just raising that question that good credentialing practices, usually every 5 years you have a new job task analysis or the rapid blueprinting process that you mentioned, and then having great leaders like Ruth Wolliver, like Nicole Pope at the board who, really then shepherded that forward. But to say you have to recognize, especially in an emerging field, it's constantly evolving. And so you have to constantly look back to, yes, it's great to have education and training standards, but those standards need to be constantly reevaluated. You don't just create them and say, put it on the shelf, it's done. There's an entire process. And so just having that insight, again, since I sat in those seats previously, that I could offer in support of then the work many did. And that's where I say it takes an entire group, NBME and their staff being such an integral part of this. But to say this is how a field gets better together. So the idea that, again, it's not one person, it's not a small group of people, it's all of us contributing to where we see the field going. And if I may mention, Diego, about the programming, because again, I'm teasing a special announcement we're going to make. So love people to stay connected. If you're on our email list, you're going to be the first to know about the surprise and delight coming your way. And it's pretty good. I'm highly biased, but it's pretty good. But I'll share
I
the part that's missing, if I may, Diego, is only to say in the field, one of the sticking points or the pain points is people saying, how can I make a viable living? I mean, if I'm just being realistic, in an
yeah.
emerging field, people are really struggling. Say, I've vested in, coach training and education. I've vested in the board, sir. But where in the world am I going to stand up my coaching practice, have a viable business, get gainfully employed? Again, I've been helping where I can to build jobs. That's what I've done in a clinical capacity. but I see the opportunity at the conference to provide not just knowledge, not just in theory, but actual skills and really helping people work in their business, like working
Mm,
in it and on it and having a plan, not just talking in theory, but this is some of the important content we'll be covering this year. What does clinical integration really mean and look like from people like leaders in the VA? The VA has been the clear leader in clinical integration of health and wellness coaches. There's no denying.
yeah.
And the fact that we do have a session around force multipliers, coaches being a force multiplier from a clinical perspective. We've got the team from the VA coming out, got Janet Clark and Sarah Klein. I mean, we've got just the best of the best people in the room. So who knows where we're going to go together, Diego? This will be exciting.
A lot of rocks being thrown. Goliath has no chance, I think. Just I really say that I appreciate two things closing off here. That that information is constantly changing in well-being and health, and we should welcome those conversations. I gave a talk recently. Someone was like, "Oh, you did a really good job handling the audience dissent." I'm like, I wanted people to challenge me, and if anyone go to my neuroscience talks, challenge me. It's a very new field, and I want to teach people how to learn about those things. And to your point about I really like what you said that you're teasing out the shared value of Vibely in this conference. How does make this actually happen? Because coaching is beautiful, but if you're just talking about it, it's philosophy. If it's not in practice because you can't make a living or you can't reach people, it's just philosophy. It's just an abstract theory. It's when it happens is where the magic happens. So how do we've gotten good at teaching people to do the skill set, understand some of the coaching skill set and my principles, but there's a big gap in then the next step. And that's when we work together for that in all our different ways in parallel, think globally, act locally. That's we'll see better world, better communities through that parallel effort.
Absolutely. And I'll just add, I know our time, we can always talk for I think that's our other shared thing we have in common. Like we're very passionate and we are talkers. But I only
Yeah.
say this. I love that you mentioned also the conference too, because that's been important to us, a space where people can have difference of opinion. In fact, should have difference opinion. People, I remember the opening panel last year, people had a lot of questions. I mean, and
Yep.
I
Oh
was
yeah.
moderating it. I only share, interestingly, I've never spoken at my own conference. And that probably tells you a lot about the values. But this year I am speaking only from opening session this year to really lean into what I'll call the discomfort.
Yeah.
Change, as we know, when we work with other people, we recognize, change is a process. Change will have discomfort, but change is always worth it. To be
Yeah.
honest, Diego, we need that lens turned back to, remember I talked about that in my own journey professionally? We need that lens turned to us as professionals, as a professional field. We've got to have some uncomfortable conversations. Do I sound like a previous interim executive director? You lean into the messiness.
Good.
I mean, that's not the glamorous stuff. It's usually not popular, but it's the needed work that sets the trajectory for where you want to go. So
Yeah.
I love rolling up my sleeves. That's going to be part of our conversation at the conference this year is like, let's get into some of those tough areas because when we put our minds together, we can do great things from there.
Yeah. It's the authenticity, that holistic approach. It's not just only the good or the bad. It's like a person. If we want to help them out, we gotta look at them it's one integrative system. And so I think this conference is a great example of looking at coaching in a very integrative way that, to your point, has not been done. You just looked at in a business way, in an educational way, not an integrative way. So as we round out here, because we could talk forever, and she will be back on the podcast in a few months, so stay tuned for that episode. Dr. Jess, where can people find more information at the conference, sign up, be part of the newsletter? Where can they go to stay in touch and sign up?
And I would love that. I'm all about connection. So please, the health and wellbeing coaching conference.com. It's our website, sign up option for our email, just so you can get, and I'll tease, in the next 48 hours, we're making that big announcement about our first of many surprise and delights for the conference. But this one is a real, again, value add because that's what we're all about. But connect with us there. You'll see all of our social, but check out the website because it does have all the speakers, all the sessions, tells you just more, reiterates many of the things we talked about of, why we are what we are and why we believe so firmly in cultivating and continuing to nourish this community that is quite special. It's honestly, it's unlike anything else. And that's something to be quite proud of.
Yeah, I'm very proud and honored to be part of this community and seeing it grow however I can. So, to Jess, thank you so much for being on this episode. Thank you for all the work you've done in the field and now in the conference. And can't wait till October before the conference. Before then, I'll see you for our next episode. Thank you to our listeners, and we'll be back next week for another exciting episode. Have a great day, everyone.